Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. I'm here to talk to you about a topic that comes up every day, multiple times a day in my practice. It's called brain fog. Now, there's no exact definition of brain fog, but what I can tell you is many of my women patients are suffering from brain fog as they transition into menopause and thereafter. And it's incredibly distressing. It is when women, and I'm just talking about women here, they can't remember. It starts with nouns. Now, it's amazing. They're very good at adjectives and adverbs. They can describe, but they can't remember names of people, places, objects. So they say, remember where we were? Remember it was raining and it was, very dark that night and it was slippery or whatever. They can describe everything. They can't remember where was it. They can't remember people's names. It's just incredibly distressing. They also just feel like their brain isn't up to speed, like they're processing slower. They read and then they can't remember what they read. They read it again, they get distracted, they're looking out the window, they can't focus, and then they think, what was that movie I went to? What was the plot? Oh my gosh, that is brain fog. It's often accompanied by emotional issues like mood dysregulation, rage. I call it road rage without the road. They get angry for no serious reasons. They get tearful very readily. It's like emotional dysregulation, and the brain is just not up to speed. It's not the person that they knew they were. And this is not an imaginary thing. It's not a hallucination. They're not exaggerating. In fact, there's studies showing that women as they transition into menopause have this problem. Now, it tends to level off. In some women, it gets a little better. In some, it goes down further. And then at the peak of their careers, often these are women in their mid-40s to mid-50s to 60. And so they're peaking in their careers, and they can't, they try to make little scribbly notes. They try to keep records, and they try to be prepared, and they don't feel they're performing as well as they should be at the peak time when they should be peaking in their careers. Now, it's not everyone. I don't want to make it sound like every woman goes into a state of dementia. Of course not. It's something that they perceive themselves. They know that they're not up to par where they had been. And it's just not the way they want to live their lives. And then they often will become fearful. Will this actually transition down the road into a true state of dementia, like Alzheimer's? And in fact, that's not totally irrational thinking, because women suffer from Alzheimer's disease at a rate 2.5 times that of men. So for example, if you took a big group of, say, men and women, the same number, and they were all the same age, we'll say 78, and you looked at how many of those people, 78 years old, have dementia, well, it will turn out that 2/3, all 78-year-olds, 2/3 will be women. So this is not a small deal. So we're going to talk about what to do about it. Of course, we don't want to just say there's a problem, good luck, but we want to first try to understand it. So why is this happening? Well, as you know, the answer is always estrogen. And now I'm refining it, estradiol, because I have to make sure we are talking about the correct form of estrogen. Estradiol, that magical estrogen that the ovaries make. Well, what are the, we'll say, signature symptoms of perimenopause and menopause? I'm sure you know it. Night sweats and hot flashes, dysregulation of the thermoregulatory centers in the hypothalamus of the brain. This is part of the autonomic nervous system's situation and relationship with the rest of the body. And the autonomic nervous system has two parts: parasympathetic, which is where you should be all the time, when you're not being attacked by wild animals, you're not in damaged state, you're not being attacked by pathogens. So it's the normal baseline state is parasympathetic. But when you are being injured, you're being like invaded by bacteria, viruses. So we call them the DAMPs and the PAMPs, damage or pathogens. Then you activate, the word we use is induce, the sympathetic, the stress state. So what happens when you're in that stress state? Much of the time, you're not being attacked by anything. You're just living your life, but you are in a sympathetic state. You're in the stressor state. Well, part of that is that you activate the adrenal glands' production of cortisol. I bet you've heard of cortisol. Short-term cortisol reduces inflammation. Long-term, it increases it. And so now you have a high cortisol, you're in the stressor state. And when you have high cortisol and you have high inflammation, and when you have low estradiol, you also have a lower threshold for the immune cells of the body, all of which have estrogen receptors, to trigger the release of their pro-inflammatory particles called cytokines. These inflammatory cytokines circulate throughout the body in the bloodstream, including in the brain, creating inflammation. We call that neuroinflammation. And we know neuroinflammation underlies mood disorders and cognitive disorders of the brain. And they go together. So now you're getting brain fog. You have neuroinflammation, you have more stressor state, you're having trouble with night sweats and hot flashes, so your sleep is interrupted as well. And what is happening when you actually have a night sweat or a hot flash in the brain? Guess what? Using functional MRIs, we now know that they actually have like a little blackout. That means a reduction in blood flow. Now, why would that be happening? Because when you get into that stressor state, which is happening when you're having the night sweats and hot flashes, because you're having the sympathetic output and not that calming parasympathetic state, you're actually causing vasoconstriction. The arteries constrict. Well, that's going to impede blood flow to the brain. And that's what they actually see on functional MRIs. So you can think of having a night sweat or a hot flash as tantamount to a mini, like a micro stroke. Or it's not a real stroke in that there's no obvious damage, but it is a time when you actually have, and this is documented, reduced blood flow to the brain. Reduced blood flow to the brain over and over damages the brain, kind of like when you all know this now because it's been in the news so much, if you have trauma to the brain, but lots and lots of little hits, not a giant concussion, that's bad too. That's like a real stroke. That's like big problem to the brain. But just little ones, little hits, like if you're a boxer or playing soccer or any kind of a sport, we get lots of small hits to the brain, but over and over, it causes damage to the brain, increasing long-term incidence of dementia. Well, that can happen when you have lots and lots of night sweats and hot flashes. You're impeding blood flow to the brain. So that is going to give you brain fog and potentially not just lead to increased cardiovascular events, that's been now documented, but also to long-term cognitive decline. So treating and eradicating night sweats and hot flashes is really important for brain health. What also is happening when you don't have enough of that vital estradiol? Your circadian rhythm becomes off. Your master clock that sits atop, this is a clump of neurons, sits atop the optic nerve and the hypothalamus portion of the brain and senses light and dark and nutrients, it drifts. So you're actually having different organs in different time zones, and that is really bad for your brain. So we know that people who travel across time zones all the time, work night shifts or going to bed at different times of day and night, they have a higher risk for many problems, metabolic problems, weight gain, diabetes, depression, and also cognitive decline. So basically, that's what happens as you enter into menopause. You're basically living a life of jet lag, and that increases problems with thinking as well as mood and a lot of other metabolic issues. And what about neurotransmitters? Well, it turns out that estradiol is critical for many very key neurotransmitters. Acetylcholine is one. Acetylcholine is the neurotransmitter for the vagus nerve that keeps you in that calm state. That's one of the reasons why as you get into menopause, you go into that sympathetic state, the stressor state, because you don't make acetylcholine properly and enough. And in the brain, acetylcholine seals in memories. It's about cognition. In fact, that's what drugs like Aricept are trying to do, increase acetylcholine by reducing the ability to break it down. The enzyme, to block the enzyme that breaks down acetylcholine. That hasn't really worked out too well, but it's important to understand that when you don't have enough estradiol, you will not have enough acetylcholine, which is important for cognitive health. In addition, I mentioned other neurotransmitters like serotonin that makes you happy and feel good. And guess what? From serotonin comes melatonin, which is key for sleep. And we know that even when you suppress night sweats and hot flashes, women, or they just don't have them, that women can still have sleep problems because they don't make enough serotonin, they don't make enough melatonin. So it takes much less estradiol, to suppress night sweats and hot flashes than to make adequate serotonin. That's why I'm always about proper dosing, physiologic dosing, so you get an optimal outcome, not just a sort of get-by outcome. And then another neurotransmitter that's really important, that's involved in existing in a body with estradiol, is dopamine. Dopamine is also really important for mood and cognition. So serotonin, dopamine, acetylcholine all rely on adequate amounts of estradiol to be produced adequately. So this is a very big deal. And I've mentioned the immune system a couple of times, and there's an embedded immune system in the brain. This immune system in the brain has specialized macrophages, a type of white blood cell, and their name in the brain is called microglia. The microglia require estradiol and progesterone, and I don't want to forget progesterone because that's so important, and progesterone is neuroprotective and very anti-inflammatory. And the microglia, when you don't have enough of these vital life hormones, estradiol and progesterone, they become like uncontrolled. They're like weapons of mass destruction without control, and they go wild, creating inflammation. They're supposed to be activated when you need them, trauma, infection, but they're activated with no good reason. And they produce enzymes that are designed to dissolve dead, damaged tissue, pathogens. But now what are they doing? They're dissolving healthy tissue in the brain, like neurons. So this is a huge issue. And it gets more complicated, but that's enough for today, because you can see that when you don't have the right hormones, there's a whole sequence of events that come into play that will affect brain health and result in brain fog. So the first line of defense is giving the hormones. This is a hormone insufficiency and then deficiency problem. So if you have a hormonal imbalance or deficiency, fix that. That's where we start. But no matter what we do, we are not able to reestablish the hormones of a healthy 21-year-old. Sorry, we do not have that capability. But what can we do? We can come reasonably close by giving physiologic levels, so we get kind of like average levels of a healthy 20-something-year-old. And then we give cyclic progesterone, because you cannot give an adequate dose if you don't give a dose that's also going to grow the uterine lining. You're a package deal, ladies. You can't exclude the uterus receiving the hormones. And in the uterus, if you have enough estradiol to do all the important things in the body, it's going to be an amount that's going to grow the uterine lining. And if you grow it, you must shed it. And there's other things about cyclic hormones. We're not going to go into them more today. I've talked about them before. I'll talk about them again. But this is the first line of defense against brain fog and protecting against future dementia. So what else? You got to do all the lifestyle stuff. My friend Dale Bredesen has shown this in his published data. You give hormones, that's necessary but not sufficient. You have to do all the lifestyle stuff. So you have to have fitness. You have to work on sleep. You got to get that sleep in, minimum 6.5 hours of quality sleep. Get a sleep study. If you wake up a lot during the night, you may have sleep disordered breathing or sleep apnea. Very common in perimenopausal women and menopausal women, which will definitely affect the health of your brain. You got to have sleep. When you sleep, you get this big rush of blood to your brain. There's a whole lymphatic system. It cleans out the gunk. You make melatonin, a very potent antioxidant. You got to get that quality sleep. And 6.5 hours is the minimum for having the ability to heal the brain and keep things working right. Try to get to bed no later than 11 because you want to get that surge of melatonin at around 2 a.m. So important. Remember, during the night is when you make growth hormone. It's just all these amazing things happen at night. Your immune system is totally different at night than in the day. And you got to let your other organs rest during the night. Because remember, we are diurnal. We're day creatures. We're not nocturnal. We're not like bats or lions. We're not nocturnal. We are diurnal. So you got to get that sleep. Fitness, exercise is like magic medicine. It is so good for the brain. It reduces inflammation. It helps with the gut microbiome. It increases the production of serotonin. They've shown that exercise is better than antidepressants for depression. So exercise, do not underestimate this magic medicine. Mind-body medicine. You got to lower that sympathetic, increase parasympathetic. So you can use a vagus nerve stimulator. You can do meditation, guided imagery, tapping, progressive relaxation, massage, acupuncture. You can do like many forms of meditation. You can do soft music. What else triggers the vagus nerve? Cold ice water plunges. I hate to say it, that's not like my thing, but some people really love it, and that's why it's becoming kind of trendy, because it does increase vagal tone. Laughter yoga, hearty laughter, laugh track creating type laughter, gargling, all can increase vagal tone and help with mood and cognition and sleep and just overall feeling good, increasing production of things like serotonin. So we want to do that. And we definitely don't want to forget having purpose, love, nurture those relationships, avoidance of chemical toxicants, poisons that can change how our hormones work or are directly toxic to cells. You need to have optimal nutrition, eat lots of fiber that nourish the gut microbiome, lots of plants, all different colors of the rainbow, only a little bit of animal, and the best quality you can possibly get. Limit, the other like chemicals, like heavy metals. So beware of eating a lot of ocean fish, unless they're very tiny fish like anchovies, sardines, or herring, because we do not want to get heavy metals like mercury. Make sure you use a water purifier, an air purifier. These are all essentials. And sometimes we have to look for chronic infections. And please make sure if you have mold, you remediate it. Mold is an endocrine disruptor and a direct toxin to our kidneys, our brain, and our immune systems. So there's much we can do. I didn't say it was easy, but it's worth it. The most feared thing when they do surveys is the development of dementia. Our brain is not optional for a quality life. Yes, brain fog is a real thing, and it has real reasons, and it has real solutions.